Hey, good afternoon. This is Dr. Gullberg, board certified infectious disease specialist. Just wanted to review with you a very important topic, bacterial meningitis in adults. I'm an adult infectious disease doctor. So organisms that cause this miserable infection are strep pneumoniae, Haemophilus influenza, Neisseria meningitidis, and Listeria monocytogenes. These are the four main organisms that do it in the community. So when people come into the ER and they have signs and symptoms of meningitis, which include a terrible headache, obtundation, possible seizure, high fever, positive blood cultures, leukocytosis, septic shock, or sepsis syndrome, lumbar puncture should be entertained immediately unless there's a seizure or signs possibly of a brain abscess, then that's contraindicated. Once the lumbar puncture is performed, we're looking at the cell count, which is generally significantly elevated, more than 500 with a left shift, a very low glucose level, a very high protein level, and a very high opening pressure. Our empiric treatments of choice include rocephin, vancomycin, and ampicillin. Ampicillin cover empirically Listeria. The rocephin covers Haemophilus influenza and the meningococcus very well. And then, of course, vancomycin will cover the pneumococcus, which may be resistant to the rocephin. Once we've got those IV antibiotics going on board immediately, we'll need to treat the patient for at least 10 days. And we'll also add IV dexamethasone. I usually start at 10 milligrams IV Q6 hours unless there's some contraindication. And at least a couple of days of the dexamethasone, and sometimes a little longer, depending on how they're doing. We monitor their cerebral edema also as needed. So patients can have significant mortality with this disease and morbidity. Often cranial nerve abnormalities need to be watched for, especially cranial nerve 8, having difficulty with dizziness or hearing loss. If their blood cultures are positive, then we have to look for endocarditis, especially with the pneumococcus. The pneumococcus notoriously is associated with endocarditis, DIC, and meningitis at the same time. A lot of times I get called and there's a traumatic tap of some kind, and I have a little formula for traumatic taps that you should know. The ratio in the serum of red cells to white cells is basically 300 to 500 to 1. So just look at the ratio of red cells to white cells in the spinal fluid. That'll tell you whether or not there's any evidence of trauma with infection or infection without trauma. So as long as you know that ratio, you should be able to figure out if there is a traumatic tap present with or without infection. So just a couple of pearls on bacterial meningitis. Signing off for now, Dr. Gullberg.